So on examination of the knee, we're checking a number of things, in particular range of motion, the appearance and the ligaments, or the stability of the ligaments in the knee. So looking at Adam's knees, you can see that there's no swelling or effusion in the knees, and if I just check the extension, he extends fully. There's no lack of extension or fixed flexion deformity. Adam, could you bend both your knees as far as you can? As far as you can, so you can see he has symmetrical flexion. Okay, straighten the legs out again. Okay, so testing the ligaments of the knee. The ligament on the inside of the knee is the MCL, and by holding the knee steady and providing a valgus stress, we can test the stability of the MCL. I don't do it with the knee locked, I do it in slight flexion so that we can actually test just the MCL and not the bony congruity of the actual joint. Similarly, the lateral collateral ligament can also be tested with a valgus stress, or a stress trying to open it up laterally. To test the ACL, I bring both knees together, I examine the front of the knee. I usually sit on the foot with my fingers on the plateau. I relax the hamstring tendons underneath and pull the knee forward. Now Adam doesn't have any lag, but if he did have an ACL deficient knee, it would come forward. The other test which I use for the ACL is the Lockman's test, and for that I place my knee underneath his femur to create a roughly 30-degree bend, support the femur and pull the tibia forwards anteriorly, and you can feel a firm end point indicating the ACL is intact. The other test, which is commonly used, is a pivot shift test. So doing a pivot shift, I keep the knee extension, internally rotate the tibia, put my hand underneath the fibula head, and as I flex the knee, try and sublux the lateral femoral condyle so that it comes out of joint. And in a positive pivot shift, it would go clunk and out. The last ligament to test is the PCL, and for that I bring both knees up. I measure if there's any step off compared to the other knee and try and push the tibia posteriorly and feel a firm endpoint compared to the other side. Okay. To examine for a meniscal tear, I would palpate the medial and lateral joint lines, assessing for tenderness, and rotate the knee with a McMurray's manoeuvre to feel for clicking, and that would be an assessment for a meniscal tear. And that completes this examination of the sports knee.